Patients suffering with a terminal illness such as cancer, multiple sclerosis, AIDS, or even Alzheimer's disease for an extended period of time. Being educated of your illness, you are aware that there is little to no room for improvements and an overall low prognosis for someone with that illness. As you lay there, you feel as though the only thing that you can look forward to is death. This is the time that patients think of death the most. With the use of physician-assisted suicide, patients are able to die with dignity, given assistance from a physician who can administer these medications. Good afternoon, my name is Kylie Arndt, and I will be discussing patient rights, justice, and the quality of life associated with physician-assisted suicide. Physician-assisted suicide should be legalized in order to protect a patient's autonomy. A patient's rights are very important when determining the care appropriate for each individual patient. A patient's rights should not be taken away in the final stages of life just because they are in the final stages of life. As long as patients are aware of the positive and the negative effects of physician-assisted suicide, they should be able to make decisions regarding his or her own care, regardless of the situation. This allows patients to die with a sense of dignity. When associating justice with physician-assisted suicide, it is important to consider fair and equal treatments to all patients. Physician-assisted suicide may possibly bring about the most benefit to a particular patient, but all patients should have the option to take part in physician-assisted suicide if they so desire. The quality of life associated with physician-assisted suicide should revolve solely around any given patient's beliefs or interests. For example, some religions may support physician-assisted suicide, while some may not. This can go back to pertaining to a patient's rights as well. If a patient cannot have physician-assisted suicide as an option, he or she may turn to other, more painful or harmful methods of committing suicide. For my visual aids today, I had a few different things. One is a picture of Dr. Jack Kevorkian, who played a major role in the start of physician-assisted suicide and actually developed his own method of administering these medications. I also have a picture of the medications that he did use to administer these medications. He used saline solution along with a sedative and potassium chloride, which were all given to him or her through an IV line. This method takes about 5 to 10 minutes for suicide to occur, which is rather fast. And then I have some statistics on physician-assisted suicide, such as 94.2% of people who commit physician-assisted suicide are white, 47.7% of them have college degrees, and the majority are between the ages of 69 and 89. This physician-assisted suicide only occurs is only legal in 7 states currently, but they are looking to expand this. In conclusion, physician-assisted suicide should be legalized in order to protect a patient's rights, as well as establishing justice and supporting a good quality of life for each individual patient. Respecting a patient's rights allows for him or her to make their own decisions regarding their own care. This includes the lack of outside influence in making their own decisions. So each patient should be aware of all aspects of administering physician-assisted suicide. Thank you for listening to my speech about physician-assisted suicide. Are there any questions?